Good afternoon, all of you. In the last class, I discussed you about the IV bolus infusion of one compartment open model. Okay, so the last topic in this one compartment open model is IV infusion. IV infusion by one compartment open model. See, ma'am, there is a lot of difference between these IV bolus and IV infusion. So, how the drug will be circulated into your body, that is very important. In case of infusion, the drug will releases very slowly. The drug will releases very slowly. That means it will undergo the distribution process or metabolism process very slowly. Most of the nutrients and electrolytes electrolytes may be supplied through this IV infusion. Okay, so you just assume how nutrients will we take, then how electrolytes will we take. So with that IV infusion, the drug release will be very slow, and that means the release of the drug will have some constant constant drug release. And in this IV infusion, we need to get some steady state infusion. We need to get some steady state infusion. This steady state means the drug release will be continuously released up to a constant period of time. So this is what about this IV infusion. And in case of IV bolus, how the drug release will be very rapidly. So here we don't have the absorption phenomenon also, because most of the drugs will undergo rapid distribution, and at one time the whole drug will be released at a single time into our circulatory system. So that means the rapid distribution of the drug and rapid elimination of the drug was observed in case of IV bolus. In this IV infusion, the drug release will be happening very slowly, and most of the nutrients and electrolytes may supply to the body through this infusion. And then there we have observed that constant drug release, so then it will be achieved steady state infusion rate. So if you remember these points, you will get. See, one compartment open model, intravenous infusion. See, which type of molecules will be suitable to transport to this pathway. Which type of molecules? Generally the drugs have precipitation, which generally the drugs will show some precipitation, and the stable concentration of the drug in the body is desired. So these drugs will not be passed through this infusion. Why? Because this is a constant pathway. So we need to get steady state also here. If the drug will precipitate, or if the drug will maintain some unstable concentration, so definitely we could not achieve proper drug release through this intravenous infusion. In case of IV bolus, we will get rapid metabolism and rapid elimination. So you prefer these kind of drugs to only IV bolus. In case of intravenous infusion, the drugs will precipitate the toxicity, and the drugs having unstable concentration in the body at the desired site, these may have some unsuitable. And some examples like antibiotics, theophylline, procainamide, these drugs are administered at a constant rate by zero order. So what do you mean by zero order? It is concentration independent. Here intravenous infusion, it will follow zero order infusion. In case of IV bolus, it will follow first order elimination. Did you remember that? So in case of this intravenous infusion, it will follow zero order infusion. And the duration of drug in the infusion is long. so that you can achieve the longer than the half life of the drug. Suppose if your drug is showing 5 hours of half life, but it will take to reach steady state concentration at 6th hour. So what it is indicating, the drug will residing in your um, um, body longer than its half life. So that is the reason for this intravenous infused drugs will have longer than the half life of the drug. So why it will take this much time? It is having half life of only 5 hours, but it will be residing at 6 hours. Why? Because we need to achieve some constant infusion and we will get steady state infusion. For that reason it will be prolongs its action in the body. So for that we will get long than its half life time. So that is the main reason. And what are the advantages of zero order infusion of the drugs? See, ease of control rate of infusion, and it will be fit to the individual patient needs. And this is the most important point. It will prevent the fluctuating maxima and minima plasma levels. So, did you remember this graph? This is the minimum effective concentration and this is the maximum safe concentration. Time versus plasma drug concentration, right? So, here it will preventing these fluctuations for this minimum and maximum plasma level, which will be desired when the drug has narrow therapeutic window. Then what do you mean by narrow therapeutic window? You just observe these two graphs. See ma, here it is having MSC, maximum safe level, and this is of minimum effective concentration. So the drugs which will shows between these MEC and MSC, they are effectively produced it pharmacological effect. And then in these graphs you need to focus only on narrow therapeutic window. Originally the therapeutic window is looking like this graph. So if the drugs will shows narrow therapeutic window, see the therapeutic window is very narrow. So these drugs may produce some fluctuations. So these can be avoided. These can be prevented through IV infusion. And electrolytes and nutrients can be conveniently administered. And then how the zero order infusion rate calculation will be. And in case of IV bolus, we calculated and we focused only on the elimination because there is no absorption or negotiable absorption we observed there. But in case of this IV infusion, you have to calculate this R0. Just remember that R0. This is IV infusion rate. See, here is your drug. So it will undergo zero order infusion rate, that is of R0. It will be transported to blood and other body tissues. Then it is going to eliminated out. So then elimination is K capital E. So this is the major concept of this zero order infusion. Only one thing you have to remember in one compartment open model. In case of IV bolus, we have seen first order elimination. In case of this IV infusion, the zero order infusion rate is there. At any time during infusion, the rate of change in the amount of the drug in the body. See, I already told you this infusion maybe take some long time to release its drug. So, because of this long time during infusion, the rate of change in the amount of the drug, that is nothing but your X, is the amount of the drug in the body, that is of this dx by dt is the difference between the zero order rate and the drug infusion, and it is also following first order rate of elimination. Only one thing here, zero order drug infusion rate is there and it will be eliminating out through the first order elimination. So there is the amount of the drug in the body difference. That is of nothing but rate of change in the amount of the drug in the body. See, that is of dx by dt is equals to r0 minus kex. Here x is representing you the amount, and this dx by dt is the rate of change in the amount of the drug. This r0 is the infusion rate and ke is the elimination rate constant. This is the basic equation for IV infusion. From this equation we will get these derivations. In your textbooks, from this equation directly they will give this equation. So I will derive you for you. Dx by dt, this is the first equation, rate of change in the amount of the drug in the body, this is of, then is equals infusion rate minus elimination into amount of the drug available in the body. Then when you integrate this equation, integration from 0 to t, that is dx is equals to integration from 0 to t r0 minus kex into dt. So then you will get 0 to t is equals to r0 by ke into 1 minus e to the power of minus ket. See here kex is there, but here I am writing ket. I will tell you why. Since x is equals to t. Why? X is the amount of the drug available at time t. In case of x naught, initial amount of the drug available at time 0. This is time 0 and this is the amount of the drug available at time t. That's why instead of x here I am writing t. See here ma'am, this derivation is not there. So when you integrate this basic equation, you will get x is equals to r0 by ke into 1 minus e to the power of minus ket. So this is the equation you will get from this equation. So see here, this equation is directly written in your textbooks. See, x is equals to r0 by ke into 1 minus e to the power of minus ket. That's what we get here. We got here, see, r0 by ke into 1 minus e to the power of minus ket. So that is the derivation for this. From this integration and rearrangement of this equation, we get this equation. Then instead of writing x, we need to replace it with c. Why? There is a relationship between the x and c, amount of the drug available in the plasma, concentration of the drug available in the plasma. Since x is equals to Vd into C, then this equation can be transformed in terms of the concentration. Then you will get C is equals to R0, x is equals to C. R0 minus Ke into 1 minus e to the power of minus Ket. This is what we get from this. Then instead of writing x, you need to transform it into the concentration form. Then what is happening here? C is equals to R0 by Ke into Vd. Then where we will get this Vd? X is equals to Vd into C. Then C is equals to x by Vd. So that's why here x is already in the form of infusion rate. That is of nothing but amount of the infusion rate available in the body. So then R0 divided by Ke into Vd. Then 1 minus e to the power of minus Ket is as usual. See here. So only the part is your x is replacing with C and here you have Vd because we have a relationship between these three parameters. And then after that this C is equals R0 by CLT into 1 minus e to the power of minus KET. Why I have written this CLT? We know already from yesterday's class, KE into VD is CLT. The elimination rate constant into volume of distribution is equals total clearance. We have this equation. So instead of writing KE into VD, you have write CLT, total clearance. Then this is of equation number 1. This is very important. This is of equation number 1. Then at the start of constant rate infusion, the amount of the drug in the body is 0. At the starting time of infusion, or initially you're going to start infusion, okay, at that time there is no drug available in the body, so then your amount of the drug, that is X, is equals to 0. So amount of the drug available in the body is 0. So if X is 0, then KE is also be 0, because no drug is available. For that, no elimination is also there. At the time passes, the amount of the drug in the body will rises gradually. Up to which mark it is going to be raised? At the rate of elimination is equals to rate of infusion. So this is the most important point. At the rate of elimination is equals to the rate of infusion. This is called steady state, or a plateau, or infusion equilibrium. Okay. So initially there is no amount of the drug will be available in our body, that is 0. So there is no elimination also. At the time passes, gradually your infusion rate will be increased. So up to which point it is going to be increased? At the point which the elimination is equilibrium with the infusion rate, that is called steady state infusion. See in this graph, clearly it is explaining you where the equilibrium will attains. See ma'am, when you plot the graph between time versus plasma drug concentration, first you just concentrate only on time versus concentration, okay. So these two graphs will belongs to one drug only. These two graphs will not belongs to two drugs. This is two graphs belongs to one drug. See how you will get two drugs, two graphs. See, first up to this mark, with increasing the time of, see, with increasing the duration time, and the concentration is also increases. Initially there is no drug, elimination and absorption, it will be 0. After the time rises, the concentration will increases gradually up to some point. From that point it is declining. So what it is indicating you? This point is indicating you the elimination phase is equals to the infusion rate. Elimination phase is equal to the infusion rate. So here your infusion may get stopped. See here, this is called the point. This is called the point. When you extrapolate this infusion stopped point, then that is extrapolated to this y-axis. Here you have plasma drug concentration, that is of C. And what do you mean by CSS? Steady state. Steady state, or also called as plateau or infusion equilibrium. At this point the infusion was stopped, and here the elimination is equals to the infusion rate. And at this point, when we extrapolate it to this y-axis, we will get CSS. This is called a steady state. So this is of, when plotted on a semi-logarithmic graph, it will yield, this curved line will yields you the straight line. The slope is minus KE by 2.303. And here Up to this mark, the time is very less with increasing the concentration. After that, the time is rising, then the concentration is also increases. This is called infusion rate, that is of R0. And from this point at where your infusion was stopped, from the starting point, and this is the infusion ending point, this time is called as infusion time, capital T. Infusion time, capital T. Then apart from this curve, you will get one more curve. Why? Because in some cases, some drug will be remained in your body. Even though it is completed its half-life and even though it is residing more than 1 or 2 hours, there is a chance to get, it maybe, there is a chance to get one more curve, same as that of infusion rate. And in this infusion rate curve, there is no steady state concentration. Why? Because this is already left concentration, either it may be 5% or 10%. So up to that complete circulation of that remaining drug, then you will get one more curve, that is of 2R0. This is R01 and this is 2R0. This is the second infusion rate. This 2R0 is second infusion rate. See, ma'am, you have to remember only 2 points here. Initially, when we are going to start the infusion, at that time, there is no drug available in our body. So that's X is 0 and then there is no elimination, that is Ke is also 0. At time rises, see here, at time rises, the concentration is also rising up to equilibrium attains. At this equilibrium, you have a concentration and you have a elimination phase here, right? So this infusion is equals to elimination. Then when you extrapolate this infusion concentration, you will get a CSS. This is called steady state. I already told you earlier, you will get a steady state constant drug release in the infusion. This will not be possible by IV bolus. So sometimes some drugs will not be absorbed properly for the first time. So you will get some remaining amount of the drug in your body. At that time, there is a chance to get one more infusion curve. This is called as 2R0. Here we are not going to observe any CSS because this is of remaining drug. You will get the curve for remaining drug. This is not the curve for first time drug. So this is what the plasma drug concentration time profile of a drug, which will be given by constant rate IV infusion. The two curves indicate different infusion rates for R0 and 2R0 for the same drug. See here, this is the graph you have to remember for IV infusion. And then at steady state, how the equations will be. At that CSS, the rate of change of amount of drug in the body is 0. That is, what do you mean by rate of change of amount? That is dx by dt. This is of rate of change in the amount, right? So this will be 0 at the CSS. So then your equation will becomes, did you remember the first equation? What it is? Dx by dt is equals R0 minus Kex. This is our basic equation. So here your dx by dt will becomes 0 when at the steady state. So that your equation is 0 is equals R0 minus Ke into XSS, or you can written R0 is equals Ke into XSS. You can write this also or this also. Both are same equations. At the steady state, the rate of change of amount in the drug will be 0. And then you have to do again the derivation for this equation. In your textbooks directly they given this, transforming the equation in terms of concentration. See here, instead of CSS, here you can written XSS. This is the amount of the drug at steady state, and CSS is the concentration of the drug at steady state. So here also same thing you have to do. What is that? Instead of writing amount, you can transform it into concentration. Then what is your first equation? First you can write your first equation. Then what is your first equation? See here, R0 by Ke into Vd into 1 minus e to the power of minus Ket. First, you can write this equation, R0 by Ke into Vd. This is C is equals 1 minus e to the power of minus Ket. This is of your first equation. And then what is your second equation here? CSS is equals to R0. CSS is equals to R0 divided by Ke into Vd. This is of your second equation. So you can substitute the second equation into first equation, 2 in 1. So how you will get? CSS, C is equals to, this whole part will is CSS, right? CSS into 1 minus e to the power of minus Ket. So you will get this equation. First you write equation 1, then you write equation 2, then you have to substitute this 2 in 1. So instead of writing R0 by Ke into Vd, you can write CSS. Okay. Then 1 minus e to the power of minus Ket. See here, the same equation is appearing here. C is equals to CSS into 1 minus Ke into T. This is of your equation. Finally, you will get this equation. And then where XSS and CSS are the amount of the drug in the body and concentration of the drug in the plasma at steady state respectively. And the value of Ke can be obtained from the slope of the straight line. Then Ke is equals to Ke by 2.303. That is the slope. Alternatively, Ke can be calculated from the data collecting during infusion at the steady state. And then after this, C is equals to CSS into 1 minus e to the power of minus Ket. You will get this equation. See here. First, you have to write C is equals to CSS 1 minus Ket. Rearranging this equation, rearrangement of this above equation, just write it down. CSS, rearrangement of this above equation, CSS minus C, same CSS minus C divided by CSS is equals to Ket. You have to rearrange this equation. You will get the equation like this. Okay. Then when you transform this above equation into the logarithmic form, then log of CSS minus C divided by CSS, that is equals to, when you remove this exponential form, you will get minus Ket by 2.303. This is of your final equation for IV infusion. Semi-log plot will compute Ke from infusion data. See, when you plot the graph, this is the semi-logarithmic graph. When you plot the graph between log CSS minus C by CSS, you will get the slope of minus Ke by 2.303. This is the last equation for IV infusion, and this is the semi-logarithmic graph for getting slope. So then the time to reach the steady state concentration is dependent upon the elimination half-life, not on infusion rate. The steady state time you reach, the concentration will be depending upon the elimination half-life. Then with increasing the infusion rate, it will increases the plasma concentration steady state. You already know that. With increasing the infusion rate, you will get the curve like this. And then this CSS equation will becomes this. C is equals to CSS into 1 minus e to the power of ket place you have to write down half, and this whole to the power of n. See why this equation comes here. For the therapeutic purposes, more than 90% of steady state concentration is desired. See, this will be reaches 3.3 half lives. Suppose if you want to reach 3.3 half lives, you require 90% of the drug has to reach steady state, definitely. So that if you want some 6.6 half life, definitely you have 99% to reach its steady state. This is the meaning of this sentence. You want 3.3 half life, that is 3 hours, 3.3 hours half lives. Definitely your drug has to reach up to 90% at the steady state. If you want 6.6 half lives, your drug of 99 percentage will reaches its steady state concentration in case of IV infusion. See, but this is the concept how it will be reaches and how much percentage of the drug will be suitable to reach exactly 3.3 half lives or 6.6 half life. But here one exceptional case is there, that is of penicillin G. The T half is 30 minutes only. The penicillin G T half is 30 minutes, but it will be reaches its steady state very soon. That is within 30 minutes only it will be reaches its steady state. Okay, and then this is of your IV infusion rate, the calculation of R0 and all. And one more small topic you have, IV plus loading dose, infusion plus loading dose. It takes a very long time for the drugs having long half-life before the plateau. Such drugs need subtherapeutic concentration. See ma, this is the plateau what we get from IV infusion, right? This is the CSS. So some drugs will get this CSS. Before that it will require some subtherapeutic level concentration. See, when you plot the graph between time versus concentration, that is minimum effective and this is maximum safe, right? So here you have subtherapeutic level. So here you have therapeutic level. So most of the drugs will require this concentration between MEC and MSC to produce CSS. But in some drugs, you require only subtherapeutic level concentration. It will reach a CSS. See here, this can be overcome by administering IV loading dose, which is enough to yield desired steady state. See, in that cases we cannot exactly decide that either it may be follows therapeutic level or subtherapeutic level. So for these kind of drugs you need to load some loading dose with IV infusion rate, then we can say that it will reaches IV infusion rate because of this loading dose. That's why it is called infusion plus loading dose. So the drugs which are not following this rule, infusion rule, and the drugs which are require subtherapeutic concentrations to produce its desired CSS level. So for that drugs, we will give some loading dose. It should follow immediately by IV infusion at a rate to maintain this concentration. See how it will be. In case of these two graphs, when you observe this is the infusion rate, okay, curve. You already know that, okay, from the previous graph you already know that. Here you have to start the infusion, then here you will get some stopping of your infusion, then here it is CSS. This steady state concentration dose is nothing but the loading dose, the steady state concentration dose, and this straight line of this blue color line will indicating you the constant plasma level. At the drug will attains this constant plasma level, you need to load the particular dose of the subtherapeutic level drugs here. This is CSS, no? In this previous graph, it is of CSS. So this is called as loading dose. Loading dose, how much concentration it will be, that is called loading dose. And then here, from this loading dose, you have one curve that is called declining in loading dose. This is the loading dose point, and this curve will shows you the declining of the loading dose. And in case of this asymptotic rise in the infused drug. Here you have to take half-lives, and here amount of the drug in the body. When you take the half-life versus amount of the drug in the body, you need to give some loading dose to the drugs which are exerting their effect with subtherapeutic level concentration. So such drugs you need to incorporate some loading dose. We will get this loading dose from the steady state concentration. So you need to incorporate this loading dose with IV infusion dose. Then you will get X is equals to VD into C. Everyone knows this relationship. Then how to calculate the loading dose? This is the formula for loading dose calculation. Loading dose is X naught is the amount of the drug available at time 0, and then comma L is the loading dose, then CSS is the steady state concentration into volume of distribution. First you have to write down X is equals to VD into C, then afterwards the formula for loading dose calculation. Then you can write CSS is equals R0 by KE into VD. Why here R0 will comes? From that equation you will get from IV infusion. See R0 by KE into VD. You will get this CSS here, and then you have to write R0 by KE into VD. Then X naught into L is equals to R0 by KE. So why here R0 by KE? R0 divided by KE into VD. One equation is there from your infusion. Okay. In the written material, I will give entire derivation part. Once you go through that written material, if you have any doubts to the derivation part, I will help you. Okay. So in your textbooks, I am clearly mentioning you there is no derivation. But your exam point of view, everyone has to write this derivation. Okay. So this is the final equation to get this loading dose. So from this loading plus infusion, you need to assess the PK parameters also. The most important parameter you can calculate from this loading plus infusion, AUC. So the first order elimination rate constant, which will be computed from a semi-logarithmic graph of the post infusion, which will be estimated from steady state. Then the equation will computed as AUC is equals to R0 into capital T. Capital T is infusion time divided by KE into VD. KU into VD, we can write it as clearance. Then the equation is like this. So this is of your infusion plus loading dose and IV infusion and the calculation of R0. Okay. If you